I'm Gayle Raleigh. Talking about my eyes. I had cataract surgery in June and a lot of issues with medication issues, and I couldn't open my eyes for about 5 weeks. Finally, they got me on the right medication. We got that taken care of, but I still had problems with the eyes as far as keeping them open or visually seeing things. So we tried the mudding here, and last time I was in, and it seemed like it really worked. The eyes opened up a little bit better. I can see a little bit better, and I think that's gonna work. Mm-hmm. So I think that's about all I can say about it.
You said there was like a heaviness in your eyes before.
They were heavy and very light sensitive, and now I can open them up and see a lot more than what I could before. Things are a lot closer and a lot brighter, and the grass is blue. So Kentucky bluegrass. So awesome. Anyway, that's my testimony. So cool. On my eyes. Thank you.
My name is Don, and I have a sixth nerve palsy, which is a eye disorder, and I used to see double lines on the highway, and then we got a little correction from it, but I ended up also seeing two people. When there was one person on television at news time, I'd see two people. If there was two people, I'd see four, so I was seeing double. And with one treatment, it was corrected, and it came back again. But now
it lasted about 3 days the first time after doing it.
Yeah, lasted about 3 days the first time, and now it's gone for good now. But we'll see, checking on, see how it goes.
Yeah, so it's still better. You can still watch the news with one person seeing it, and what you notice the clarity come back
and it's
too.
Also very clear. The television is very clear, which I didn't know it was fuzzy to begin with, but now it's much clearer.
But once it changed, there you go.
Yeah.
Okay, well, all right. Well, thanks for sharing your experience.
Yep, you're welcome.
Hi, I'm Gayle Raleigh. I came in here with some eye issues this morning. I couldn't see like a television. Well, now after treatment, I can see everything from over here, and I can see much better. My eyes are open. I don't feel like there's a heavy weight on them like they did when I first came in here. Now I can see a lot better.
So it's kind of like tunnel vision, and then now it's all like, fields are opened up.
That's all fields are opened up, and I feel like I can see again, and so.
Awesome. In like maybe 5 minutes.
Yeah.
We did that. Yeah.
Since the treatment, it just kind of opened them up.
All right.
So.
Well, thank you for sharing.
Good. Thank you.
I am Paul, and this is first day at Dr. DeYoung's chiropractic office, and I'm in for an eye problem and a swallowing problem. My eye problem is I see like a hair or something in my left side of my eye when there's really nothing there. I feel a slight pulling on the eye, and in the morning, especially when I'm looking to the left, I see flashes of light, and went to the eye doctor, and they didn't really have anything that they could do. And there wasn't a issue with the retina yet, but he said some of that's normal part of aging, and hopefully it'll go away in a few months.
Yeah.
And it's gotten better, but I'm glad I'm here.
Yeah.
And
well, we'll see if you notice a difference with what you've been dealing with. So.
Okay. And my swallowing, it seems like I have a smaller esophagus. I have to take smaller bites. Have been having to do that my whole life, basically. And then stressful because, sometimes, my whole family, especially on my mom's side, they always choke. And so, and then just about a year ago, I had an esophageal spasm, which is just, I had ate a little piece of jalapeno salsa, and it just closed up on me involuntarily. Couldn't breathe at all. Very traumatic. And that went away in a few seconds, so I'm very thankful for that.
Yeah.
But very traumatic, and called the nurse line, and they explained it as esophageal spasm. Mm-hmm. And they just advised me to stay away from the trigger foods. And I go, well, how do you know what the trigger foods are? Don't really know.
All right. Well, thanks for sharing.
This is Paul Pesky, and just wanted to update you on the condition of my eye, and after 2 treatments, the pulling and tightness is gone, and the flashing is reduced to almost gone. And so that's great. Looking forward to that healing up really nice. And then my hip, it's after 1 treatment, I couldn't believe it, but there's no pain in the hip. And then a little pain moved down into my knee, and we're working on that. But yeah, the hip pain is gone.
Yeah.
And
And
so
how's the knee today?
and the knee is really good. You know, and that's after 2 treatments.
Yeah, so pretty
And
great
so
changes
that's-
in a
yeah.
short amount of time.
Really good.
All right, thanks for sharing.